Welcome back. For those who have an autoimmune disease, being extra careful during the pandemic is so important. So Ray Chin finds out how you can protect yourself.
Intermountain Healthcare Doctors are urging patients taking immunosuppressive drugs to be extra careful during the pandemic, and especially as we relax some of these restrictions. Dr. Paul Jensen with Intermountain here to talk about the concerns for this particular group. And Dr. Jensen, we have emphasized the people with underlying health issues, cancer, respiratory issues, lung problems, and also heart disease. But there's another category here that we want to focus on.
Yes, so people have rightfully been very concerned about their friends and family members who have cancer and diabetes and high blood pressure. But the group of people who I deal with are people who have diseases called autoimmune diseases, diseases in which the immune system, which normally fights off infection, starts attacking the body. And we treat people who have these types of diseases with medicines that weaken the immune system. So these are people like rheumatoid arthritis, lupus, psoriasis, Crohn's disease, as well as many, many other diseases who are taking these medications that do put them at higher risk for COVID-19.
And Dr. Jensen, these are pretty common medical conditions in our community, some 109,000 people that we're talking about here in Utah.
Yes, indeed. So these are your friends, your family members, your colleagues. Many of these people don't look sick. You may not know that they have these conditions or that they're taking these medications. But yeah, these are conditions that all of us know people who have these conditions.
It is that common. And so when you hear about relaxing some of these restrictions of having 20 people or so in a group and being able to dine and go to the salon, what are your concerns right now?
So first of all, I am thrilled that the people of Utah have done such a good job heeding the governor's recommendations, heeding the recommendations of the CDC. And that we have not had the large spike in diseases here that we've had in New York. But realizing that there are so many vulnerable people among us, as these restrictions are loosened, please, not only for yourself, but for your family members, please do the things that are recommended. Wear a mask when you go out into public. Masks are there to protect other people from you, not just to protect you from other people. Wash your hands frequently. Carry hand sanitizer with you and use it frequently. If you have one of these conditions, still try to keep your distance. Try to stay 6 feet away and socially distance.
And Dr. Jensen, we only have a few seconds, but are you suggesting that this very vulnerable group still stay inside?
So I'm recommending that this vulnerable group, as much as possible, still try to stay home. But they can come out as the other people. But like I said, wash your hands frequently. Stay away from people as much as possible, even as you're coming out into the public.
And wear that mask. Dr. Jensen with Intermountain Healthcare, thank you so much for those reminders for all of us to keep all of us safe. For more information, you have all of it on intermountainhealthcare.org. We're going to have that on our link, abc4.com. Thank you so much again, Dr. Jensen.
Thank you.